Hey everyone, it's JD coming to you. Let's see, it's day 9 post shoulder surgery. Things are progressing pretty good. Pain is it's still there, but it's nowhere near as bad as it was the first few days. Man, I'm telling you that that night that the nerve block wore off was probably the most excruciating pain I've ever endured in my life. So I'm not hitting the pain meds as often, but last night was pretty bad as far as just trying to get comfortable. Doc has given me the clearance to try to sleep on the bed on my back, wearing the sling. I tried the recliner. It worked for a while, and it just got I just couldn't get comfortable. So moved over to the bed. The first few nights were pretty good. But last night, for some reason, I just could not get comfortable. There's a point right in my shoulder, right where they removed some scar tissue from. Actually, also had tore my bicep. Sorry, I just woke up from a nap. But some of the scar tissue that was still there, he went in and shaved off, which is you can still see the bruising right in here. That area gets really, really tight and real uncomfortable. And usually get up in the middle of the night, put some ice on it, and go back to bed. So probably got, I don't know, 4 or 5 hours of sleep last night. I just woke up from a nap. Same thing. I'm okay for about an hour, and then it just really starts to tighten up on me. So, hopefully things start getting better. My appointment is Wednesday to go in and have the sutures removed from where they opened me up and did the orthoscopic surgery there. So continue to do physical therapy twice a week on Tuesdays and Fridays. This past Thursday was pretty brutal because obviously they just keep pushing you a little harder and a little harder and a little harder. And range of motion is getting better. So that's good. And they're introducing new little exercises here and there. So my advice to anyone who's looking at this type of surgery, it's definitely, I would definitely recommend it, especially if you're enduring pain like I was before. The pain that you're going to endure is a different kind of pain. It's not the same type of pain that you had prior to surgery. But, and if you have a nerve block, again, I cannot emphasize this enough, that you start taking your pain meds long before that nerve block wears off, because as soon as that nerve block wears off, all heck is going to break loose. And I cannot stress that enough. So make sure you start taking your pain meds long before that nerve block wears off. And start icing. Icing has really, really been very beneficial for me. I bought this little gadget. It's 2 little pouches that come in a little box, in 2 sizes of reusable gel-filled ice bags. And so you put it in the sleeve and it wraps around, and it's really, really comfortable. And so I use that a lot. So yeah, I mean that's pretty much it. And again, this has probably been the worst surgery I've ever endured. I've had knee surgery, ankle surgery, cancer surgery to remove my cancer thyroid. I've had back surgery, but this, and no doubt, this has been the worst as far as pain and recovery. So, I hope this serves to give someone some information that's looking down the road of having to go through this type of surgery for a torn rotator, torn labrum, and they cleaned out some stuff out of my AC joint. So we're getting there. I'm hoping to get the green light to go back to work eventually, probably this next week or the week after. So I'll know better once I meet with my doctor on Wednesday. So thanks for listening, and I hope this helps someone. So there'll be more videos down the road here as I've got more information to share with everyone. So be blessed.